Now we're going to talk about sit to stand and stand to sit. So if we have our patient that's ready to walk, okay, we're ready to do some ambulation. We're going to stick with our idea that this is the involved side. Let's use hip fracture as an example, or total hip replacement. Either way, they're going to have some trouble putting full weight on that side, and some people they can't put on it at all. So what we want to do with those folks set the walker in front of them. She's already forward pretty well. We want her to bend her good leg. Put this down a little bit further. You're not so tall. Bend it back a little further. We want a little bit further back. Then you want her heel back behind her knee. Otherwise, when she goes to stand up, she's not going to have the leverage to pull herself up with that leg. And then, because this one she's not going to be able to put full weight on, or it's going to be painful, we will slide that forward a little bit. Like that. Perfect. Once we're in that position, we're ready to stand. Okay? So what we don't want the patient to do, if we can help it, is to grab the walker and try to pull themselves up. That's not the best way. Sometimes it's the only way you can get people with dementia to do it, because you put it in front of them, you just let them do what they want to do, and just help them as they need. But folks that are oriented and they understand everything, better to have them push from the bed. If they insist on putting one hand up, it's okay. They can put it, for example, in the middle of the walker here, like that, and then they use their other hand to push up here. It's best, though, to push from both sides. So we're always, always, always going to use a gait belt when we get people out. Okay, it's absolutely mandatory. So put the gait belt around Courtney. Don't be afraid to make it a little bit snug. That's okay. You want to have control of the patient so that they don't fall and you're safe too. So we've got our gait belt on her, and what we're going to have her do, this one's out forward, right? And the importance of having this forward is that in order to stand, we need to make sure that she can hinge a little bit forward. It's very difficult to stand up from here. You're just going to fall backwards. But if we can lean forward, it facilitates that coming up to standing much easier. Right? So we have the leg out here so that, for example, if she has a hip replacement or a hip fracture, she's not going to bend into that zone where it's quite uncomfortable, and with a hip fracture, actually potentially dangerous. So we've got her in a good position. She's going to lean forward. Generally, it doesn't matter. You can be on either side. I'm going to be on this side because obviously you have to shift your weight. The patient has to shift their weight towards their good leg in order to stand. So she's going to, what I'm going to ask her to do is to lean forward and then stand up. Okay, good. And you grab the walker. You see I've got my hand here on the gait belt just to the right of center because, have a seat again. If I've got her on this side, on the side that is towards her strong one, and she starts to go over to the right and starts to lose her balance that way, I'm in trouble. So I like to hold it back over on this side. So again, she's going to lean forward and then stand. Good. All right, excellent. Now, let's say we've gone for our walk and we're back. What we want to do is to make sure that the patient does a couple things for us. First, we want to make sure that her good leg, the non-surgical leg or non-operative leg or non-injured leg, is back against whatever she's going to sit on. Whether it's a bed, whether it's a chair, whether it's the toilet, whatever it is, she has to have contact with the good leg against. So, do you have it?
Yes.
Good. And then now, what are we going to do? We're going to have her, what? Kick her right leg forward. Like that. Now we're in a position where her hip is safe. Bring it back again. If the patient is unable to do that on their own, and it's sometimes true, then I may reach over there and pull it forward for them. That's okay. That would be easier to do from the other side. For the sake of the video, we'll do it from here. Now, in this position, it's easiest for the patient to reach back from the side that she has her good leg on, just because she's unbalanced on that one, not putting so much weight on the right leg. So reach back, with the left, slowly sit, great, and relax. Excellent, nice job. That's basically a stand transfer to a walker. We also might have to get somebody to a wheelchair. And for folks that don't have very good balance or strength, we may need to give them quite a bit of assistance. So that assistance might be required for balance only. In that case, we can do a stand pivot transfer. Or if it's that they can't put weight on one leg or they're quite weak, we may need to do a lot of physical heavy lifting ourselves. So the first thing I'll show you is a stand pivot transfer into a wheelchair. So unfortunately here at UMC, we don't have wheelchairs that are that user-friendly, honestly. Most of them are a little bit wide, and if we have narrower patients, it's a little bit challenging. And also the rooms aren't terribly large, so maneuvering the wheelchair in and out can be a challenge. When we think about using a wheelchair for transfer, sometimes we want it real close. Sometimes it's not important, but I'm going to show you what we do when it needs to be real close. Unfortunately, again, because we've had issues with people walking off with equipment sometimes, we only have the ability with these wheelchairs to push these out to the side like so. Now you can see here that these are bolted down. All right, these do not come off. See this right here? It doesn't come off. This should be able to lift off and it'd be a lot easier for us to transfer. You just do the best you can. If you absolutely need to do a transfer and need that extra 3 or 4 inches, what you do is you go to 3 West and the nursing manager, and they have little Allen wrenches, and you can remove it. It's okay. You only usually need to remove one side because we're only going one direction usually for our transfers. But basically you just swing it out to the side to create some room. Also, if you want to do a squat pivot transfer, sometimes you have to take the arm off towards the side where the patient is, so just pull it up like that, and it's just a lot easier to swing the patient over than it is to try and get them over this. So with a stand pivot transfer, maybe we're talking about somebody that has weight bearing is tolerant on one leg. They want to get into a chair, bedside commode, into a wheelchair, something like that, but maybe they need to do it now, right? Sometimes people have to go to the bathroom now. Maybe the walker is not here. So what we can do is a stand pivot transfer. So let's scoot you forward a little bit, Courtney. Good, right there. Now, let's assume again that our right side is our injured leg. So we're going to have her put her weight leg a little bit forward, like that. And what I'm going to do is stand like this. So I've kind of got her blocked, like so. I don't want it directly in front. I don't want it directly to the side. I want it kind of at the corners of the knee. Okay? There. Now with a stand pivot transfer, because the patient can still do quite a bit of the work, I'm going to hold on to her here, like so. Okay? Not up here. That's not going to work. I'm going to hold on to her here. And she's going to put her hands on the bed. Good. You're going to lean forward and then stand and then grab me. So here we go. We're in this position. I've got her stabilized. And we're just going to turn. Go ahead and turn your feet. Good. And then reach, scoot back until you feel against the chair. Remember, that's our principle. Is your left leg against the chair?
Yes.
Good. Kick your right leg forward. Excellent. Reach back with your left hand. Good. And slowly sit. There you go. Now, look at my back. You can see my spine. What position is it in? It's in a position where I'm not going to get hurt. So if you do this, now you're in a position where your spine is in a bad spot. You can strain your back this way. And if you do any lifting from this position, you might be asking for trouble. So what you want to do is come down to a squat position, like that. See the difference? Okay, excellent. Okay, good. Let's have you take a seat back on the bed. Now for the squat pivot transfer, we're going to be doing most of the work. The therapist or the tech or the therapy assistant is going to be doing most of the work. So in this instance, what we want to do is we're going to pull the wheelchair pretty much as close as we can. like so. Now, one of the keys is just going step by step. So what we're going to do is we're going to put Courtney in a place that makes this transfer very easy, okay? So what we're going to do is we're going to take her and put her in a little bit of a diagonal on the bed so that it's going to make it easier to transfer, okay? So what I want you to do, Courtney, is move your hips this way. So your hip is over here, that's the way, like that. So maybe close to a 40-degree angle or so. So let's scoot you forward a little bit so your feet are on the floor. Good. Now in this position, we don't have to work very hard to get to the chair. If she's straight away, it's going to be more of a lift or a movement for the therapist and for the patient. So again, let's bring this up a little bit closer. Now we're in a position where it's very simple to do our transfer. What you want to do is, again, the good leg going towards the good leg. All right, we got our good leg next to the wheelchair. What we're going to do this time is we're going to put our feet either side of her good leg. Okay? Feet either side of her good leg. So we're kind of stepping up into her, not on this side, but on this side, like that. Okay? So we're stepped up kind of between her a little bit. We're going to use the same technique as a stand pivot transfer. I'm here, right? And what I'm going to do is have her this time hold on to me. So you can hold on to me here. In this position, again, look at my spine. Okay? I'm in a good position. What we're going to do is we're going to use a count of 3. We're going to 1, 2, 3, and we're going to use a little momentum. Okay? You just relax. And you can use this a little bit, but let me do most of the work. Okay? So what we're going to do is we're going to do 1, 2, 3, and then we're going to turn and put her over in the chair. Okay? So we're here, you hang on to me, right? Got me? Mm-hmm. Okay. So I got myself, if you can see my feet bend, I've got my feet also turned. I'm not straight onto her. I'm turned a little bit too. See that? So in just a little bit. So I'm here, we're going to facilitate leaning forward. We're going to go 1, 2, 3. Like that. So Ben and I just got our 285-pound man out of bed, and he's not very strong, unfortunately, so they're going to require 2 of us to get him up. So let's say we're going to go back to our example of decreased weight-bearing tolerance on one leg. We'll use the right one just for consistency, and Courtney's put her foot forward, just as she should, as to protect the hip and make sure we don't put too much weight on the leg initially. So in this position, sometimes the patient requires more assistance than just one person can give. So Ben's here with me. What we're going to do again, have the patient push from the bed, and we're going to each hold on to the belt. And I'm going to block, you can see here, I'm going to block her good leg so that that foot doesn't slip out in front of her. So I'm going to block it with my foot there, and then we're going to be here, holding onto the belt. Got it? Good. And what we're going to do is have her lean forward, and we're going to use our count of 3 again if somebody's quite heavy. So I'm going to say on the count of 3, we're going to stand up. So we're going to go 1, 2, and 3. Push, 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 and grab the walker. Excellent. Just like that. Same thing when we go back, scoot back a little bit so your foot is against the bed. Got it? Good. We'll have the patient reach back with one hand like this, and then we help them down if they need it. Now, sometimes the patient's non-weight bearing, or perhaps they have an external fixator on. So what I'll have Ben do is monitor that left leg, that right leg, and he can either do that with his hand or with even his foot. We can kind of even put it under here so that we know that they're not putting any weight bearing on that leg. So we're in that position. I'm going to block her good leg with my foot here. We're going to do the same thing, count of 3. 1, 2, and push, push, push. All right, all the way up tall. Good. Ben still got the foot controlled, so we know that there's no weight bearing on that leg.